Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Shum, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about how to use a TENS unit with low back pain, and basically we're going to show you correct pad placement. As a bonus, at the end of this video, we're going to show you a treatment that you can do along with the pain.
Two of them,
along with
right?
The TENS, yeah, two different treatments that work with a lot of back patients, and you can sometimes by using the TENS. It calms down the pain enough that you can do the treatments successfully.
So yeah, there are two exercises.
Yep. So what we're doing here is we're not really showing you how to use a TENS unit. And we're not trying to be deceptive here, but what we're going to
do show it on other videos.
We show it on other videos.
Yep.
Brad and I have tried dozens and dozens of of TENS units, and they all worked. They all work great. A lot of them are really powerful. A lot of them work out fantastic. Some of them have really poor instructions.
Sure.
So we decided after a while, after we reviewed quite a few, that we're going to endorse just one brand. And we endorsed the iRelieve because it's FDA approved, it's compact, it's powerful, it has it all, it's good instructions.
Yeah, they work well. We're happy with them.
In addition to their instructions, we've actually done a step-by-step video on how to use three of their different models.
Right.
The 1313, the 8080, and the 5050. And that varies from their low-priced one up to their highest-priced one, which is a wireless one.
Right.
So if you want to see those, go to bobandbrad.com, go to our program section, and look for the TENS program.
Right.
And under the TENS program, you'll find a video that says 1313 step-by-step or 8080 step-by-step.
And along with that, as well as these, there's PDF printouts for each video.
Thanks for reminding me, Brad. We didn't mention it on the last video.
Yes, I forgot too. But that makes it very convenient. You watch a video, get the printout, and that way you don't have to refer back to the video. You can look at the printout, and it'll remind you of what we talked about.
Yeah, so like if you find this video on our website, there'll be a printout of what we talked about today, so you know where to place the pads.
Yep.
And that's what we're going to talk about next. So we're low back pain. We're going to show you one-sided with one channel, and then we're going to show you low back pain. Let's say you have a more larger area, so we'll show two-sided with two channels. Now, all of you have told us that you don't want to see us with our shirts off, so we're going to have our cameraman, Mike, come on out, and I'm going to be the camera person.
Oh, you are?
Yeah, you can handle it, can't you?
Well, give it a go, Bob.
I can comment still behind the camera, too.
Sure.
So, all right, Mike's going to come on out, and everybody take note of his SpongeBob shirt. That's his pride and joy. So luckily Mike is not mic'd up, so we can't hear him. So Mike, if you want to go ahead and I know the camera can pick me up. Mike, if you want to go
faintly.
All right, there we go. So Brad's going to start off with the low back. Again, one-sided. That means one channel.
Yep. Okay. So we're going to start one channel. We have our pads here. Typically, all of these will come with 4 pads, 2 pads per channel. We colored them yellow and green each channel, just so it's easier to see. They'll come black. Sometimes they're white, but they're not colored when you pull them out of the box. It's just for instructional purposes. Each channel gets 1 wire, which actually has 2 wires.
Yeah, leads, they're also called.
Yep. Leads, pigtails, you'll hear different terminology for that. So you're going to take a pad. Let's say Mike, my fingers are cold, Mike, so he might jump.
He's going to jump.
On the right side, let's see belt line pain right there. Yep. If the pain is right there, that's kind of a focal point. One option is to put one pad right over the painful spot. Okay. And then take the second pad, and you could go above. Now, the big thing you do not want to do is go too close. You should never be touching. You want to keep the width of one pad that's about there, that much distance between, or you can go a little farther, but you're not going to go way up here. So you're going to be that 1 to 2 inches there. And then Mike could take this and turn it on and increase the intensity and see how it responds.
Yeah, so it's always an experiment.
Yep.
There's really no specific right or wrong.
Yep.
Mike's gonna, give it a try. If it feels good, yeah.
Yep. Leave him there.
Yeah.
If he doesn't like the way it's feeling, it's not managing the pain or reducing the pain, you could try over here. You could try over here. I'm not going to have him pull his pants down, but we could go below. We're not going to obviously go over the cloth. And one thing I didn't mention yet is make sure you clean the skin very well with soap and water. Dry it well. Keep the pads clean. They always keep these plastic keepers, I'm going to call it, available. You always put them back on there when you're done and pull them off.
You can take off the oils of the skin with soap and water because that would also affect the pads.
Right. Didn't I mention that?
Oh, did you?
That's all right. It's always good to hear it twice because it's really important.
And if Mike has a gorilla back with hair on it, you're going to have to shave it, but he looks pretty smooth.
Exactly. If you do have a hairy back, you really need to shave it because that will interfere with the conduction of the current and the effects of it, as well as keeping the pads last longer. So, Bob, should we go to 4?
No, how about the other option of, let's say you go surround the pane. Let's say you only have 2 pads. But let's say, one, if you point to where the pain is.
The pain is still the same location, but we're going to go on both sides of it. So we're going to cross. So the current actually goes from one pad to the other. And so just imagine that's where it's going. We can go there. We could go here and then below the pain.
Yeah.
I'm going to go there, pretend the pain is up higher so that I can go on the skin. Or you can go crisscrosses. It really doesn't matter where you put it, but you want to cross the pane. If the pane is a global area on this side, are we going to go 4 channels on one side?
I would also say, Brad, right from the start, I probably wouldn't put it right on the spine, right on the bony spine.
Sure, yep.
I would stay off that area. I would stick more into the soft tissue.
Sure, like that.
Yep.
Yep. And then over here, let's say if it is, we're going to go way up to here. Let's say it's kind of a global area. Then you take both channels, which works fine to use them both at the same time.
So now he's using all 4 pads.
And I'm going to take channel 1 and place them as such. Channel 2, we're going to go here. Oops.
And again, on the PDF, it's got actually pictures of this, so you can get that reinforced as to where you might try it.
Yep.
But do you want to show how the current travels between the 2, Brad?
Yep. So it's going to go yellow to yellow, channel 1 to channel 1, channel 2 to channel 2, so it crisscrosses, and that way you get a more broad area for pain management and to decrease that pain. Again, I can get these a little farther apart without any problem. I'm certainly not going to go this far apart.
Sure.
That's too far. So, you can cover one side of the back easy. And actually, we're going to show both sides of the back.
Yeah, if you go both sides of the back, you could put one on one side and one on the other side. Yep, just like that.
And this works nice if it's more central, but a larger area.
If you're feeling it on the spine, but we don't want to put pads on there, there we go. And then we got a crisscross going on.
Now, I just want to repeat this again. I've had a lot of patients where the pain is at the belt line. So then obviously you gotta drop the pants down, and you'll have the pads actually on one
the
buttock on each side, on each cheek, and these will drop down, and then you just pull the pants up over the top, and that works good because that actually holds the pads in place a little bit.
Yeah, see what works for you. I mean,
exactly.
It's nice. You can hook up the pads, and then you just put the unit in your pocket, and you've got some relief all for a couple hours. And luckily with 10, sometimes you get some relief afterwards, even after you stop using them.
Yeah, that's very common report. So these would be all hooked up accordingly. This would go in his pocket, and
all right,
set it up.
Mike, why don't you come on back? Brad, want to take those off?
Oh.
And then we'll show the exercise next.
Oh, okay. So I'm going to take them off, and like I mentioned before, we'll put them back on the holding plastic their home to stay clean.
Thank you, Mike.
Good work, Mike. Putting up with my
Yeah,
ice cold hands.
he does have cold hands. All right, Brad, if you want to stand up, if you don't mind for a second, I'm going to go ahead and jump right into this.
Go ahead.
Now, a common exercise for just the average person, let's say you're not too old, like when you get into your 50s and 60s, a lot of you are going to have spinal stenosis and some arthritis, and this may not feel good. So this is probably maybe for a little bit younger person, but this is one that you should always try, is trunk extensions. So what you're going to do is lay flat on your stomach, hopefully not crush your thigh. Put your hands right underneath your shoulders, and you're going to press up. And we start off with like mini press-ups, Brad calls them.
Yeah. So notice he keeps his waistline at the belt
Yeah,
there.
I'm not lifting up like this.
Right.
I'm getting movement in the spine, and it's kind of the opposite of what you typically put stress on the back during the day. You're doing a lot of bending forward during the day. This helps counteract that.
Right.
Helps it stretch in the other direction. And then eventually you want to see if you can get all the way up like this without lifting your pelvis off.
Right.
If you'll get up to here, then your pelvis starts coming off. Yeah, you have to keep working this area here.
Keep in mind, if this irritates or if this causes pain, or particularly pain down the leg, then you're not going to want to do it. You should just do this gently. It should feel good while you do it and after you get done. Yeah,
people often say it hurts so good. You know, it feels like the right kind of pain. Now, one that you almost everybody can do would be the gentle, what we call trunk rotations.
Sure.
So you lie down in the hook line position. Your feet are on the bed or on the floor, and you're just going to keep your knees together, and you call it the windshield wipers, don't you, Brad?
Well, that's what I instructed to my patients, because if you look at it from your view, you're going back and forth like windshield wipers.
So it's like windshield wipers, and like you said, it's a way of remembering visually what's going on.
Sure.
And if this bothers you going in one direction, don't go in that direction.
Right.
Go in the other direction for a while,
Yep.
and then try it again.
Yep.
But this can really loosen up the back. It's a great one to do in the morning before you get out of bed.
Sure.
It's gets the back warmed up prior to starting the day. And this is, with both of these exercises, it's something you can do not just once a day. You can actually do it every hour as a way to keep the back moving and relax it and to start combating pain. So how do we end up so long on this video, Brad?
I don't know, Bob. I'm going to blame it on Mike.
Okay, yeah, it's Mike's fault. That's that SpongeBob cert. Thanks for watching.